Hi, welcome to Professional Certifications channel. Let's break down RHIA exam preparation, one topic a day for focused and effective learning. Today's topic is secondary data in healthcare.
1. What is secondary data in healthcare? So, what exactly is secondary data in the context of healthcare? Secondary data refers to information that was originally collected for a different purpose, but is now being used for new research or analysis. Unlike primary data, which is collected firsthand for a specific study or project, secondary data is repurposed from existing sources. In healthcare, secondary data can come from various sources, such as electronic health records, EHRs, insurance claims, clinical trials, patient surveys, and administrative databases. This data is often used for purposes like quality improvement, public health research, policymaking, and healthcare planning.
2. Sources of secondary data in healthcare. Secondary data in healthcare can be derived from multiple sources, each providing valuable insights into different aspects of patient care, population health, and system performance. Let's explore some of the key sources of secondary data. 1. Electronic health records, EHRs. EHRs are one of the most common sources of secondary data in healthcare. They contain detailed information about patients' medical histories, diagnoses, treatments, and outcomes. EHR data is often used for clinical research, quality improvement initiatives, and population health management. It allows researchers and healthcare providers to analyze trends and identify opportunities for improving patient care. 2. Insurance claims data. Insurance claims data includes information on the services provided to patients, the costs associated with those services, and the payments made by insurers. This data is valuable for understanding healthcare utilization patterns, analyzing cost effectiveness, and evaluating the impact of different payment models. Claims data is often used by policymakers and researchers to study healthcare access, affordability, and disparities. 3. Clinical trials data. Clinical trials generate a wealth of data on the safety and efficacy of new treatments and interventions. While the primary goal of clinical trials is to test specific hypotheses, the data collected can be repurposed for secondary analyses. Researchers may use this data to explore new research questions, validate findings, or conduct meta-analyses. Clinical trials data is crucial for advancing medical knowledge and improving patient outcomes. 4. Patient surveys and registries. Patient surveys and registries collect data on patient experiences, outcomes, and quality of life. This data is often used to assess the effectiveness of treatments, understand patient satisfaction, and monitor the long-term health of specific populations. Secondary analysis of survey and registry data can provide valuable insights into patient perspectives and help healthcare organizations tailor their services to meet patient needs. 5. Public health databases. Public health databases, such as those maintained by the Centers for Disease Control and Prevention (CDC) or the World Health Organization (WHO), contain data on population health, disease prevalence, and health behaviors. This data is used for epidemiological research, public health surveillance, and policy development. Secondary analysis of public health data can help identify trends, assess the impact of public health interventions, and guide resource allocation. 6. Administrative data. Administrative data includes information collected by healthcare organizations for operational purposes, such as hospital admissions, discharge records, and billing data. This data is often used for performance measurement, quality improvement, and healthcare planning. Secondary analysis of administrative data can help organizations identify inefficiencies, reduce costs, and improve patient outcomes.
3. Uses of secondary data in healthcare. Secondary data plays a vital role in various aspects of healthcare, from research and policymaking to clinical practice and quality improvement. Let's take a look at some of the key uses of secondary data in healthcare. 1. Clinical research. Secondary data is frequently used in clinical research to explore new research questions, validate existing findings, and conduct meta-analyses. For example, Researchers may use EHR data to study the long-term outcomes of specific treatments or to identify factors associated with certain diseases. Secondary data allows researchers to leverage large datasets and generate insights that would be difficult to obtain through primary data collection alone. 2. Quality improvement. Healthcare organizations use secondary data to monitor and improve the quality of care they provide. By analyzing data from EHRs, claims, and patient surveys, organizations can identify areas where care falls short of standards, track performance over time, and implement interventions to improve outcomes. Quality improvement initiatives often rely on secondary data to measure the effectiveness of changes and ensure that they lead to meaningful improvements in patient care. 3. Public health research and surveillance. Secondary data is essential for public health research and surveillance. Public health agencies use data from various sources to monitor disease outbreaks, track vaccination rates, and assess the impact of public health interventions. Secondary data helps identify trends in population health, evaluate the effectiveness of public health programs, and guide policy decisions that promote health and prevent disease. 4. Healthcare policy and planning. Policymakers and healthcare planners use secondary data to inform decisions about resource allocation, healthcare access, and system reform. By analyzing data on healthcare utilization, costs, and outcomes, they can identify disparities in care, assess the impact of policy changes, and make evidence-based decisions. Secondary data is crucial for ensuring that healthcare policies and programs are aligned with the needs of the population. 5. Benchmarking and performance measurement. Healthcare organizations use secondary data for benchmarking and performance measurement. By comparing their performance to industry standards or peer organizations, they can identify areas for improvement and set goals for enhancing care quality. Secondary data allows organizations to track their progress over time, measure the impact of interventions, and demonstrate their commitment to delivering high-quality care. 6. Population health management. Population health management involves analyzing data on the health status, risks, and needs of specific populations to develop targeted interventions. Secondary data from EHRs, claims, and public health databases is used to identify high-risk populations, monitor health outcomes, and tailor care plans to meet the unique needs of different groups. This approach helps healthcare organizations deliver more personalized and effective care.
4. Benefits of using secondary data in healthcare. Using secondary data in healthcare offers several benefits, making it a valuable resource for researchers, policymakers, and healthcare providers. Let's explore some of the key advantages of using secondary data. 1. Cost effectiveness. One of the primary benefits of using secondary data is cost effectiveness. Collecting primary data can be expensive and time-consuming, especially when dealing with large populations or complex variables. By using existing data, researchers and organizations can save time and resources while still gaining valuable insights. This makes secondary data an attractive option for many healthcare studies and initiatives. 2. Large sample sizes. Secondary data often includes large sample sizes, which enhances the statistical power of analyses and allows for more robust conclusions. Large datasets provide the opportunity to study rare conditions, examine subgroups, and explore trends over time. This level of detail and breadth is difficult to achieve with primary data collection alone. 3. Longitudinal analysis. Many sources of secondary data, such as EHRs and registries, contain information collected over long periods. This allows for longitudinal analysis, where researchers can track changes in health status, treatment outcomes, or healthcare utilization over time. Longitudinal data is essential for understanding the long-term effects of interventions and identifying patterns that may not be apparent in cross-sectional studies. 4. Generalizability. Secondary data often comes from diverse and representative populations, increasing the generalizability of findings. This means that the results of studies using secondary data are more likely to be applicable to broader populations, making them valuable for informing public health policies, clinical guidelines, and healthcare practices. 5. Access to rare or sensitive data. Secondary data sources may include information that would be difficult or impossible to collect through primary data collection, such as data on rare diseases, sensitive health conditions, or patient experiences. Access to this data allows researchers to study important but less common phenomena, contributing to a more comprehensive understanding of health and healthcare. 6. Opportunity for replication and validation. Using secondary data allows researchers to replicate and validate previous studies, which is essential for confirming findings and establishing evidence-based practices. Replication helps ensure that results are reliable and not due to chance or bias, ultimately contributing to the credibility and robustness of healthcare research.
5. Challenges of using secondary data in healthcare. While secondary data offers many benefits, it also comes with certain challenges that researchers and healthcare organizations must navigate. Let's discuss some of the common challenges associated with using secondary data. 1. Data quality and accuracy. One of the biggest challenges with secondary data is ensuring its quality and accuracy. Since the data was originally collected for a different purpose, it may contain errors, inconsistencies, or incomplete information. Researchers must carefully assess the reliability of the data and address any limitations that could impact their analyses. 2. Data privacy and security. Secondary data often includes sensitive health information, raising concerns about data privacy and security. Researchers and organizations must adhere to strict regulations, such as HIPAA in the United States, to protect patient confidentiality and ensure that data is used ethically. Data de-identification and secure data storage are essential for minimizing privacy risks. 3. Lack of control over data collection. When using secondary data, researchers have no control over how the data was originally collected. This can be a limitation if the data does not include all the variables needed for a study, or if the data collection methods were not standardized. Researchers must work within the constraints of the available data and be transparent about any limitations in their analyses. 4. Potential for bias. Secondary data may be subject to various forms of bias, such as selection bias, reporting bias, or information bias. For example, EHR data may overrepresent patients who frequently visit healthcare providers, while underrepresenting those who receive care less often. Researchers must be aware of potential biases and use appropriate statistical methods to account for them. 5. Complexity of data integration. Integrating data from multiple secondary sources can be complex, especially when the data is stored in different formats or systems. Merging datasets, ensuring compatibility, and maintaining data integrity require technical expertise and careful planning. Data integration is essential for creating comprehensive datasets, but it can be time-consuming and resource-intensive. 6. Ethical considerations. Using secondary data raises ethical considerations, particularly when the data involves vulnerable populations or sensitive health conditions. Researchers must ensure that their use of secondary data is ethically sound, respects patient autonomy, and contributes to the greater good. Obtaining appropriate permissions and conducting ethical reviews are crucial steps in the research process.
6. Best practices for using secondary data in healthcare. To maximize the benefits of secondary data while addressing its challenges, researchers and healthcare organizations should follow best practices. Let's explore some key strategies for effectively using secondary data in healthcare. 1. Assess data quality. Before using secondary data, thoroughly assess its quality, accuracy, and completeness. Review the data collection methods, check for missing or inconsistent data, and consider how any limitations may impact your analysis. High-quality data is essential for producing reliable and meaningful results. 2. Ensure data privacy and security. Adhere to all relevant data privacy and security regulations when using secondary data. Implement measures such as data de-identification, secure data storage, and access controls to protect patient information. Ensuring data privacy and security is critical for maintaining trust and ethical standards in healthcare research. 3. Use appropriate statistical methods. Apply appropriate statistical methods to account for potential biases and confounding factors in secondary data. This may include techniques like weighting, stratification, or multivariate analysis. Using rigorous methods helps ensure that your findings are valid and generalizable. 4. Document and report limitations. Be transparent about the limitations of the secondary data you are using. Clearly document any issues related to data quality, completeness, or potential biases, and discuss how these limitations may impact your findings. Transparency is key to maintaining the integrity of your research. 5. Integrate data thoughtfully. When integrating data from multiple sources, ensure that the data is compatible and that the integration process preserves data integrity. Carefully plan your data integration strategy, and use standardized protocols to merge datasets. Thoughtful data integration enhances the value of secondary data by creating more comprehensive and detailed datasets. 6. Obtain ethical approval. If your research involves sensitive data or vulnerable populations, seek ethical approval from an institutional review board, IRB, or ethics committee. Ensure that your use of secondary data aligns with ethical principles and that you have obtained any necessary permissions. Ethical approval is essential for maintaining the credibility and integrity of your research.
7. The future of secondary data in healthcare. As healthcare continues to evolve, the use of secondary data is expected to grow, driven by advances in technology and data analytics. Let's take a look at some trends that may shape the future of secondary data in healthcare. 1. Big data and advanced analytics. The increasing availability of big data and advanced analytics tools will enable more sophisticated analyses of secondary data. Machine learning, artificial intelligence (AI), and predictive modeling will allow researchers to uncover new insights, identify patterns, and make more accurate predictions about patient outcomes and healthcare trends. 2. Integration of genomic and clinical data. The integration of genomic data with clinical data from EHRs and other sources will open new opportunities for personalized medicine and precision healthcare. Researchers will be able to use secondary data to explore the genetic basis of diseases, develop targeted therapies, and improve patient outcomes. 3. Expansion of data sharing initiatives. Data sharing initiatives, such as open access databases and collaborative research networks, will facilitate the use of secondary data across different organizations and research teams. These initiatives will promote greater collaboration, reduce duplication of effort, and accelerate the pace of healthcare innovation. 4. Enhanced data governance and privacy protections. As the use of secondary data expands, there will be a growing emphasis on data governance and privacy protections. Healthcare organizations and researchers will need to implement robust data governance frameworks, ensure compliance with regulations, and adopt best practices for data security and ethical use. 5. Use of real-world evidence. Secondary data will play a key role in the growing use of real-world evidence, RWE, to support regulatory decision-making, clinical guidelines, and healthcare policy. RWE, derived from secondary data sources such as EHRs and claims data, will provide valuable insights into the effectiveness, safety, and value of medical treatments in real-world settings. 6. Patient-centered data initiatives. The future of secondary data will increasingly involve patient-centered data initiatives, where patients have more control over their health data and can choose how it is used for research. Initiatives such as patient registries, health data platforms, and digital health tools will empower patients to contribute to secondary data studies and advance healthcare research.
Conclusion. In conclusion, secondary data is a powerful resource in healthcare that enables researchers, policymakers, and healthcare providers to gain valuable insights and improve patient outcomes. By understanding the sources, uses, benefits, and challenges of secondary data, and by following best practices, healthcare organizations can harness the full potential of this data to drive innovation and enhance care quality.